After more than 20 years of practice, she has the 360-degree perspective of medicine. She has extensive experience in hospital medicine, post-acute care in rehabilitation, nursing home, and memory care, which is such a big deal these days. So we thank you for your work, Dr. Van-Horne. She is integrated in the multidisciplinary team approach as a medical officer in psychiatric care. She is a medical director for home health and aesthetic medicine in the medical spa experience. And in short, she understands the complete patient. This is what Dr. Van-Horne brings to the table in your healthcare in a caring and thorough manner that, ladies, we deserve. So please help me welcome. You can use your reactions and your emojis if you wish on the chat, whatever you do, whatever you feel comfortable doing. Please help me welcome Dr. Simone Van-Horne.
Hello, everyone. I'm Dr. Van-Horne, and as Stacy says, my relationship with her goes all the way back to high school. And we happened upon this subject, yes, because she was in the hospital, but in addition to her not knowing, I thought it was really important because when I started my perimenopause journey, I didn't know, and I was a doctor, right? And I had, even at that point, quite a bit of experience. And I must say, medical school and even my residency program didn't really highlight the issues surrounding perimenopause and menopause. And I figured what I do to kind of really highlight this and make this really stamp all of you who are in this room this evening is take you on the menopause journey that I had and the perimenopause journey that I didn't know that I was going through, and let you know how that affected me during my perimenopausal time, the aspects of my life that it affected. So it would really resonate with some of you guys who are struggling. And for those of the people who are on board who are my patients, right, that they know that there's no low that you can really tell me, because I've been there, right? And so thank you for introducing me in terms of you know, my experience, but also in the prayer. And I'll start off myself with opening this discussion by saying James 5 verse 16, confess your faults one to another and pray for one another that ye may be healed. And so in essence, what I'm doing here is healing myself, because I'm going to be sharing a lot of things with you on my perimenopausal journey, and in teaching you, I'm also healing myself. All right, let's go. Next slide. So we're going to go on a journey back in time, right? And my perimenopause really began, if I really think about it, it happened really after I had my kids. But I did not realize it was happening because really no one had ever pointed it out to me, not my obstetrician. I mean, like I said, as a doctor, I don't really have a primary care physician. I really have colleagues who are taking care of me, who don't really see me as a patient, right? Which is kind of the bad thing when you become a doctor, that sometimes we kind of have tunnel vision. But even so, I didn't know, right? And we're going to go back in time to help you see why so many of us get missed, right? Because I, as a physician, was probably blaring as a perimenopausal patient, right, that needed help, but it got missed, right? Let's go forward. So next slide. So my journey really began at the University of Pennsylvania Health System. And a lot of you already have this health assessment chart, right? And this is really how I begin my I begin my discussion with my patients, because a lot of those things on the health assessment chart that you'll see here, some of you would have received this on in your emails, and some of you will have this from my Facebook page or my Instagram page. Really look at that and be very honest with yourself as to what things in this are severe and very severe. In women, what is actually very strange, and every time I see it, it's very telling to me that a lot of women just tick in all of them, none, all of them, nothing's wrong, right? And actually for me as a doctor, that's my biggest red flag, because I know that there's something wrong. But what happens to a lot of women and men as well, actually, is that they don't think anybody can do anything about the stuff that's there. Their irritability, their exhaustion, the joint pains, the cognitive things, waking up in the morning and having to have coffee by 3 o'clock in the afternoon. And if you don't have it, you're going to die. You can't think, you can't remember anything. You know, walking past beds and like wanting to jump into the bed, right? They think that this is just a product of age. It's a product of the people in their office are making them crazy. They're the ones who are annoying them. My wife is annoying me. My husband's annoying me. The kids are, you know, annoying, right? And really, those things may be true, but also what is true is these things are more pronounced because of the hormonal changes that are happening. Next slide. So here we are at University of Pennsylvania system, Pennsylvania Hospital. Pennsylvania Hospital was actually the first residency program in the United States. It was the first hospital in the United States, right? And it's the first place where surgery was done in the United States. They have like the amphitheaters where people used to come to watch surgery. You would drink some liquor before they did the incisions and cut you without any anesthesia. And it was an honor, really, and a pleasure to work there. And there we have my name's there. That was 2003 where I began as a resident. But they have residencies, students and interns going all the way back to like the 1800s. It's pretty fascinating. Let's go. Next slide. So while there, I became pregnant in my last year of residency, and I was considered an elderly prima gravida. Elderly prima gravida means that you are an old person having a baby. And for many of us in this generation, or Generation X, we're having babies older. Now, the other aspect of why menopause is so difficult and the perimenopause is so difficult for us is because our testosterone begins to decrease at age 25, because we are fearfully and wonderfully made, but we are also made for a purpose. And that purpose was really meant to, if you really look at the body, you are really meant to have babies earlier rather than later. By the time you get to about 34, 35, 36, your hormones are decreasing, but in particular, your testosterone levels are decreasing. And your testosterone levels are actually, somebody needs to mute. Your testosterone levels are actually exceedingly important to your vigor, your interest in sex, your ability to be interested and motivated, your ability to not have pain, to your ability to think clearly and cognitively be your best, right? So, you know, in my residency program, I was, as you heard, I was a chief resident. I was the youngest person who got whatever awards. I was on top of everything. I was very clear cognitively, right? After I had my baby, I realized that I was more anxious. I was more irritable. I lost a lot of zest for life. I was somebody who loved going out, doing lots of things. And I really blamed a lot of that stuff just on the more responsibilities that life was throwing on me, right? That I now had graduated and I now had to work like a real job. and get things done, right? And really, as I'm watching more and more women, I'm seeing more and more of those women get, into perimenopause, and they're experiencing this. And they're wondering, why is it that it's so onerous? Like, why is it that it seems harder for them than it did for their mothers? Well, our mothers in general had babies earlier. Our mothers in general, when they had those babies and they went through the stress of having babies, their testosterone was able to bounce back to normal. Now, when you have a baby at 34, 35, 36, 37, 38, 39, 40, your testosterone is almost half of what it is when you're 25, right? So the stress of having a baby means that you're going to be up late at night. You're not going to be able to work and take care of the baby without it being like a huge deal. That may not be so much of a big deal when you're in your 20s, right? Yes, it's going to be hard, but it's much harder when you get older. Now, when your adrenaline levels and your cortisol levels are that elevated because of stress, what those do is it depresses testosterone. So we have a double whammy. We have testosterone, which is half of what it is, and then we have stress causing more adrenaline and cortisol, super depressing our testosterone. And in the 30s, I'm seeing more and more women with testosterone in the 20s and 30s, which is actually low, right? You feel your best with a testosterone of about 90. So let's go to the next slide. And it's what happens after we have kids, as I just alluded to, is that adrenaline goes up, cortisol goes up, and the cortisol, if it stays up too high, it mobilizes blood sugar, right? Because stress really would mean ancestrally, or even just 400 years ago, it would mean a wild beast is chasing you. There's famine, there's war, there's plague. You have to move quickly, move the tribe quickly. And what stress means now is, your alarm bell goes off at 4 o'clock in the morning and startles you out of bed. Stress is you're watching news and you're hearing about this war and that war and another war that's on the way. Stress is people being rude to you, when you go to buy something, or just making your life ridiculously hard for no reason, right? This is the world that we are now living in. And all of these things, we're in rush hour traffic and people are bad driving you and, whatever, not allowing you to go over into the lane for no reason, right? These things increase our adrenaline, increase our cortisol. Cortisol mobilizes the blood sugar, but it's not a wild beast anymore. You're just sitting down sedentary. And when that blood sugar goes up, increasingly what's going on is you're becoming more and more pre-diabetic and then diabetic, because the blood sugar is not in keeping with running away from a wild animal anymore. You're just sitting, getting irritated, right? The adrenaline that's pumped through our system causes constriction of our blood vessels, and that it causes increase of our blood pressure, right? And so now you begin to see, right, what is kind of transpiring in our society with the increase in stress and things just kind of generally being out of order, right? And the order really that God created us to be in. The other thing that happens when we have babies is if you are too stressed out when you're having the babies, your sex hormone binding globulin increases. Sex hormone binding globulin is a protein that binds to your sex hormones, your testosterone, your estrogen, your progesterone. And what it does is it does not make it as available to the cells. Now, you have in your 30s, your estrogen and your progesterone are sky high, but your testosterone, like I just said, is quite low. So what happens is that although you do have some testosterone is really much lower because it's not available. It's bound to this protein. And nature produces this protein because it really is trying to preserve your energy for the kids that you do have. When you bind that testosterone, what happens is your sex drive goes down because your body is trying to preserve you from having more kids so that you can take care of the kids that you do have. That's really the nature's way, God's way of like kind of preserving you, right? Because your body's recognizing that you're exceedingly stressed out, and it tries to take that drive away, and just let you preserve yourself for the kids that you do have. So we have women increasingly with decreasing sex drive. The testosterone helps our muscle mass. The testosterone helps us to have zest for life. The other corollary to that is that we just start to feel older when we're in our 30s, much older than probably what our mothers felt like. All right, next slide. And again, what then begins to happen is that our adrenal glands and our ovaries start producing less testosterone, as I mentioned. And this lack of testosterone, which is causing us less energy, more headaches, we're not interested in sex, we have more muscle joint aches and pains, because testosterone is a potent anti-inflammatory. All those things are beginning to happen, right? And they begin to happen to women, and they think, oh, it's just because I had the babies and things got stretched out, and yeah, that's, I have more back pain since I had the baby. But really, it is, in addition to that your testosterone levels dropped dramatically after you had babies, because it was so stressful. And when your testosterone drops that dramatically, you've lost your body's natural anti-inflammatory. And in addition to that, you have to take care of kids. I had one child, after my first child, who had lots of energy. I had boys, right? And you're running around behind these boys, and whatever energy you do have after you come home from work, you're using it to run behind your kids. Next slide. So let's talk about testosterone and the benefits, because that's really the perimenopausal hormone that's really decreasing and really giving us our symptoms. Testosterone helps you to sleep, right? Testosterone, actually, people think that testosterone is a hormone that makes you like really angry and really butch and really whatever. But no, testosterone helps you to sleep, which is why in general, women can't sleep in their 30s, 40s, and definitely by their 50s. And men seem to be able to sleep no matter what, right? And women are like, you're just lazy, you have nothing to bother you, right? But it's not that. It's just that they have more testosterone, right? After a workout, you'll have very, very good recovery, right? Because testosterone helps us to produce collagen, right? So even if you have some muscle damage from a tendonitis, let's say, right? The more testosterone you have, the less that's going to get out of control, because testosterone, as I said, is a natural anti-inflammatory. By the time you get into your 40s, your risk of having joint pains and aches and damage, to especially like with our athletes, you'll see what the 30-year-old athlete can do, the 40-year-old athlete can't do. What a 20-year-old athlete can do is not what you can do after that. That's not just wear and tear. A lot of that is hormonal. As I said, the adrenaline and the cortisol that's happening increasingly in all of us, right? As we have to hear the news that's going on, have to go through all these wars, have to go through an increasing crime, have to go through people who are just, what the Bible called hard-hearted, right? People who just are mean and cruel for no reason. Those things raise our adrenaline and raise our cortisol. And when that happens, if your testosterone is low, there's nothing to meet that, right? Adrenaline is going to keep you up at night. Cortisol is going to make you more fat. The antithesis of that is testosterone, which gives you more muscle mass. It helps you to calm down, right? If your adrenaline levels get high, the testosterone meets it there and helps you to calm down and get things back into perspective. The other thing that testosterone does that a lot of women don't realize is the reason why men don't get breast cancer the way we do is because they have more testosterone. So when our testosterone levels begin to decline, we also have more proliferation of breast tissue, and that breast tissue proliferation can get out of control. And that is what we are beginning to realize is actually what leads to our increase in breast cancer. So having a higher testosterone level for longer, right, actually decreases our risk of breast cancer. Testosterone and estrogen are both receptors that are on our bones and our muscles. And the testosterone receptors and the estrogen receptors actually more. It helps the bone to remodel because they form osteoclasts and osteoblasts, which are basically our building blocks of very strong bone. So as we start to lose these hormones is where osteoporosis, or before you get to osteoporosis, osteopenia begins to creep in. And if these hormones and your vitamin D, etc., are not kept in proper balance, you find that by 60, you trip and you fall, and here you are having a fracture for no reason. You don't know why. Well, it's because your testosterone was falling since you were 25 years old and started to exponentially decline when you were in your 30s. The other benefit of testosterone, as I said, which is what people really associate testosterone with most of the time, is strong muscles, bulking up and stuff, because of the fact that it helps with muscle regeneration. But as we all know, people who have more muscle actually have higher metabolic rates, right? Testosterone actually is a receptor on most of our cells, and it helps with insulin to get into our cells. So the more testosterone you have is the less insulin resistant you are, which really means the less ability you're going to have to be a diabetic. Testosterone also helps to increase your good cholesterol and decrease your bad cholesterol, right? Sorry, that's a little typo there. It decreases the LDL and it increases your HDL, right? HDL is our good cholesterol, which binds up the plaque in our arteries and basically acts as a scavenger of bad cholesterol, and it dumps it in the liver, and then we pass it out in the stool. So testosterone, we're realizing, helps us in a cardiovascular manner. And actually, historically, in the 1940s and 50s, before we had things to dilate our blood vessels for heart attacks, they used to give testosterone, an injection, if you were having a heart attack. Let's go, next slide. So we couldn't get this to work, right? But this is the adrenal body type, right? And this is the body type that you tend to see as we get more menopausal. And we now recognize that a lot of this is adrenal fatigue. And for those of you who like to Google, you could Google that. And adrenal fatigue is really the increasing adrenaline and the increasing cortisol that we're seeing in our population now. And people keep saying that it doesn't exist, right? The experts say it doesn't exist. Well, the experts don't know what they're talking about, because it totally exists, because we're literally seeing people walking around looking like this, and we're seeing, if you do the blood work, the testosterone levels that are declining, right? So this is very much a phenomenon that's happening, and the experts don't know what they're talking about. Next slide. Next slide. All right, so now as stress progresses, you start to get burnout symptoms because of that adrenal fatigue. Because as I said, your perimenopause has to do with your testosterone going low. So testosterone actually contributes to all of these things. Your low libido, that's affecting our marriages, right? I can't tell you how many marriages I've saved just by fixing people's moods and desire to have sex, because men interpret a woman's lack of desire for sex that, well, I'm just going to cheat because she's not giving me the sex. This is what men like. This is how they interpret the whole situation, because they don't know, right? And so once we start to shine the spotlight on the fact that the reason why she doesn't want to have sex is because of this, it really helps men to understand like their woman a little bit better, and try to alleviate a lot of the stresses that she's under, because we now understand that it's stress that's decreasing this testosterone. And the woman also understands that that's what's happening to her, and not thinking that she's just not interested in her partner anymore, because it's a very confusing body to be in when you don't desire the person that you're married to. And this is happening in a lot of marriages. It's not only happening to women, it's also happening to men who are losing their testosterone, although we're not talking about that. but it's happening to both sexes, right? And I would put money on if couples did their hormonal levels, we would probably save a lot more marriages. The other thing that's happening is that digestion is slowing down because your whole intestine, your whole gut, testosterone is on every single organ. It's on your brain, it's on your skin, it's in your back, it's in your muscles, it's in your bones. It's everywhere, right? So digestion also slows down when your testosterone is slowing down. But adrenaline and cortisol, remember we talked about that this is associated with stress and that fight and fight response when you're going to be getting away from an animal, a wild animal. So when you're in the fight and flight response, what happens is that blood flow is taken away from your GI tract and it's sent to your muscles, right? Because it thinks the stress that you're having is not just some rude person that's annoying you today. It really is a wild animal, right? And hence, the more stress you have, the more reflux you have, the more irritable bowel syndromes you have, the more constipation people have because there's just dysregulation in the GI tract. This is all hormonal or neurotransmitter mediated. The cognitive changes begin, brain fog happens, mood changes happen, you're more depressed, you don't want to go out, you're anxious, you're exhausted, you have more joint aches and pains, right? You're feeling older, poor muscle recovery. You go to the gym and it takes you 2 days to recover from a hard workout. More injuries. Then you work out and then you injure yourself because your collagen production is not there and your testosterone is just not there to build that and keep that muscle. Thyroid begins to slow down. Your thyroid and your testosterone are actually very intertwined. As a matter of fact, the thyroid is intertwined with almost all of the body, but that's a whole other conversation. And you have more headaches, right? Because as I said, the brain is full of testosterone receptors as well. So cognitively, that changes, and then you start getting more headaches. But you think it's stress, or you think it's because it's hot, or you think it's because somebody's, the children are driving you crazy. No, it's your hormones, right? So next slide. So I'll intervene now to really make you guys understand like how this can really affect you. And I may be a worst case scenario. To be honest, I after seeing a lot of patients and they tell me a lot of stories, I don't think I've met yet the patient who's told me the story that I'm going to tell you about my perimenopausal low. Cognitive changes get worse, your mood changes get worse. And this is missed by most physicians. After I had my first child, my mood changes, my libido, I just began to feel like I had an literal out of body experience. Didn't want to have anything to do with anything that I was doing in my life. And it was so bad, it led to my divorce. I didn't recognize that. I went to a psychologist, I went to a psychiatrist, nobody picked it up. I had an obstetrician because I also lost a child. That the stress can also do that. So that was another stressor for me. I lost a child, and the obstetrician who I was explaining all these symptoms to, they didn't pick it up either. They just said, Van-Horne, women lose babies, right? These things happen. Like the numbers, but the numbers don't really mean anything when you're in that situation. It doesn't mean anything to your hormones. They're still going to be secreting the same. They're still going to be doing what they're doing, regardless of what you know cognitively. Your body is wired to do that. So I moved to the United States, and that was a whole other stress in and of itself. And I ended up working on the night shift, and the night shift totally displaces you. It's not the way human beings are created to exist at night. We're supposed to be in the day. We're supposed to be exposed to sun, be around vegetables and trees and birds and animals. In reality, being on a night shift, they really have a right to call it the graveyard shift because it really does put you closer to the graveyard than other jobs, right? Anyways, I began to feel extremely exhausted, extreme brain fog. And one morning I woke up and it was just before my period and I felt it was PMS on steroids. I just felt I did not feel myself. And my little one who's right here, he was sleeping. And I was like, just let him sleep. I'll come back home and get him. Nobody else could do it in the house that morning. So I went to work. I did my patient's rounds, and I had done this before. I came back to get him, to take him to the daycare, which was right on the hospital compound. And when I went back to get him, my phone was just blowing up. Everybody had a problem. The nurses wanted everything now. Everybody wanted things yesterday. The patients, they wanted to leave right now, right? And that was just the phone calls I was getting on the way home, on the way back. Anyway, I get back to work and I'm there trying to get stuff done, trying to get the patients out, trying to be everything to everybody. And I heard my name on the overhead thing at the hospital, and they're like, Dr. Van-Horne, we need you now. And I'm like, oh my God, how many people are going to need me like yesterday? How many people are going to need me now? And I have my period, right? I'm like totally feeling like an out of body. There's no coffee that could help me, right? I had about 3 cups, nothing helped. Anyway, the security met me at the elevator, and he said, Dr. Van-Horne, we've been calling you, and overhead pages. I was just trying to finish off what I was doing. I'm coming, I'm coming. He said, you left your baby in the car. I thought, he had to hold me up, first of all. I could not believe that I left my child in the car. In any event, it happened. The police were brought in. It became a whole big case. I had to go for psychiatry evaluation to see if I was of my right mind. That's how brain fog can be. How bad. So there's no patient that I see that can tell me any story about perimenopause that I can't relate to, that I can't see myself in them, right? And to date, I haven't met the person who had a story quite like mine, or who could put it together. And so I saw all these doctors, I saw psychiatrists, I saw psychologists, I saw a lawyer, I saw a doctor, Indian in chief, I saw everybody. And I had to stop working because, of course, there was like, she needs to have a psychiatric evaluation. Like, what is this? Who is this? So here is Miss Perfect. I was the non-teaching award, first person, whatever, all these different accolades, right? And here it is, my brain fog was so bad, right? And I thought, well, it was just stress, it's just stress. I had, before I could get back to work, I had to have a panel of physicians sit down and speak to me. And none of them said, you should check your hormones. None of them said none of them had a clue, right? And I say all of this to say, here I am as a doctor, I don't have a clue. I saw so many doctors over all this time, none of them had a clue. Anyways, so I decreased my stress. I think I changed that job because that job was exceedingly stressful. And that's another thing. I guess what one of the things that I want to see is that women were not created to carry that much burden. They don't have the testosterone to carry that kind of a load, right? Women just are not men, period. End of story, right? And I think the things that we're beginning to see in society is kind of showing us that, right? Now, coincidentally, when I left my son in the car, it just so happened there were all of these spates of people, women and men, I think, who were doing the same. And even on Facebook, I saw all of the judgment. People were like, how could they do that? How could they leave the child in the car? How? And I was just like, how could you? You know what I mean? So I say this to you guys, you know, in a place where we're supposed to have grace, right? That it's important to really know people's stories, people's backgrounds. And I think that's one of the reasons why it's so important for me to share this story, because your hormones are really important to a lot of things, right? And a lot of people who are going through hormonal things, they just feel all the shame, right? Even the sexual thing. Women hide the sexual dysfunction they're having from even their husbands, right? The fact that it's painful to have sex because they've lost the moisture, like all of these things, or the desires, or they're faking orgasm, they're faking whatever, right? And they're distraught in my office, right? Telling me things that they're not telling the person they're supposed to be telling, right? And so this is the kind of grace that we need. This is hopefully, you know, telling you this story in your health ministry. You guys are going to be more equipped to see where spirit and flesh meet, right? Because that's really I've now come through it. It still hurts to talk about it, but the more I talk about it and I heal other people, is the less painful it becomes. Next slide. So I guess I'm looking at myself at that point. At that point, I should have had my hormones checked. At that point, I should have had my vitamin D checked. I should have had my vitamin B levels checked. Subsequent to that, with me as a physician going, okay, no, look, really, what's going on? I did check my vitamin B level. I did check my vitamin D level, and they were critically low. My vitamin D level was about 12. And I'm in the sunny state of Florida, and I grew up on an island, right? And I love the beach, right? And I'm a Black person. I'm always like out, right? And I really don't even, I'm not a good person with wearing sunblock. And yet I had a vitamin D that was critically low. And vitamin D also contributes to bad exhaustion. Vitamin D is also in itself a hormone, right? That helps other hormones to work, testosterone included, right? They're all intertwined and interconnected. So what things should have been done? All of those things should be checked. And I'm very, very anal, as you can imagine, as a physician. Some of my patients like accuse me of like just trying to get money out to them and getting money for the insurance company and all these things. But they don't know my backstory. That's the backstory. The backstory is I'm exceedingly anal about checking that, because once you realize that when these things are balanced and checked off in your body and how well it works, right? Your body's a machine, and it needs, you know, oiling, and it needs a little WD spray. Like these are our WD sprays. These are the things that help our bodies to work. And so those things need to be checked, right? Ashwagandha, that's, you know, there's a lot of stuff about ashwagandha. I don't know if people really know how ashwagandha works. That should have been something that, if I was talking to myself back then, that I would have also at least considered. Is ashwagandha decreases cortisol and it decreases adrenaline. And those two things are suppressing your testosterone. So if you decrease the adrenaline and you decrease the cortisol, your testosterone gets to come up and your brain fog is improving. Your muscle joints and pains improve. Your mood improves, right? So that's another thing that can help. When you're under a lot of stress as well, and close to burnout, it's very important to keep your serotonin levels up. And people hate the idea, some people hate the idea of taking antidepressants or anti-anxiety medicines. It makes them feel like they're more sick. It makes them feel like they're going to be dependent. None of these things are necessarily true. But to replace that serotonin in a more natural way, there is 5-HT, also called 5-hydroxytryptophan. And that helps to boost your serotonin levels and helps to kind of offset like that stress that we're dealing with, because the stress leaches out our serotonin. Along with vitamin B12, your folate is also very important. These things are help, they're cofactors at your receptors, and they help things to go in to cells and help your cells to just behave more efficiently. And your thyroid hormones, a really deep dive into your thyroid should be done, not just to see if you're hypothyroid, but to see if you have antibodies to your thyroid. We're finding that like about 45% of Americans actually, because of the preservatives in the food and the GMO foods and the endocrine disruption that's happening because of the food, all this weird stuff that they're doing with our food, we're finding a lot of antibodies to the thyroid and generally hormone levels that are not optimized. Next slide. Now, the other thing that I definitely would have needed at that stage, right, when I saw that my brain fog was getting worse and I saw that I was needing more and more coffee and it still wasn't helping, those are red flags, right? Your exhaustion is a red flag that needs to be validated. It's a pity that we don't have anything in our jobs to kind of acknowledge this and give people time off, right? Or people are made to feel as if they take the time off, that their job will still be in jeopardy, which which happens quite a bit. Or if they take the time off, they just don't get a paycheck, right? So these elements in our society right now is leading to people being worn out, right? But testosterone administration does help you to get more energy. It does help your muscle mass. It does help you to just be able to do more, right? And this happens the testosterone administration can happen in the form of injections, tablets, creams, and pellets, right? The injections and the tablets, I really don't even have a discussion really with my patients about those, because injections are oil-based, and I just have a problem with injecting oil into the bloodstream in any way, shape, or form. And a lot of our athletes who do get testosterone injections, these are the reasons why they can be so buffed and just drop down dead for no reason, seemingly no reason. Well, they've been administering an oil-based product to themselves for years, and this has led to a lot of plaque disease. And because of the athletes using the hormones in this manner, that's what's kind of given hormones a bad name, about heart attacks and strokes, etc. But injections and tablets are synthetic, right? And synthetic means that they are not like nature, right? The only thing that you have that is like nature are testosterone creams and testosterone pellets. Pellets being the bioidentical form of the hormone pressed into a tablet, and it goes under the skin. The creams, however, don't get the levels up to where it needs to be. Like I told you before, it needs to be about 90. Only 55% of the creams is absorbed, right, in most people. And the other thing about the creams is that it can transfer to your loved ones. It can transfer it to your kids. Next, you're giving testosterone to your daughter, right? When they're really young, at 3, 4, 5, that could be a problem. You can transfer the testosterone to your cat and your dog, right? And they start acting weird. So the creams have to be given in areas where it doesn't make contact with people. You don't forget to leave it on door handles or, in the bathroom all over. And then the pellets, that's the kind that I administer in my practice, which is slowly absorbed over a 5-6 month period. You don't have to worry about taking tablets, and it can be very precisely controlled using a formula to administer that just for you. And it can also, we can use blood work to see exactly where your levels are. Next slide. So I didn't want to talk too much about menopause because that is the next level. The title of it was really more perimenopause for me to kind of concentrate on. But menopause is the next the next level of stress, right? And menopause, I was able to recognize menopause, but by then, as you can tell, a lot went wrong before I even got into menopause. So menopause was awful, right? And it wasn't awful with the hot flashes and stuff, although that was bad. It was awful with the exhaustion. It was awful with the joint aches and pains, right? Because what happens in menopause is your testosterone levels are already low, but when you lose estrogen, a whole new set of drama comes in, because testosterone and estrogen together are potent inflammatories, anti-inflammatories. So when your testosterone is low and then you lose estrogen, the joint pain is off the chart. The other thing is that estrogen and testosterone together are really good for you cognitively, which is why I think a lot of men will always be asking women to do this and to now, hindsight is now 2020 as I'm watching my patients, where men are always asking women where this is and where that is. It's because they don't have as much estrogen as we do, right? But when we lose our estrogen, we are just like the men, right? In terms of the cognition. And the other thing that we catch up to men with when we lose our estrogen is the risk of heart attack. Estrogen is a potent inhibitor of plaque formation and balancing our coronary arteries as it pertains to fats and lipids depositing. Men, their testosterone and ours, the testosterone does metabolize into estrogen. So men do have some estrogen and they need that estrogen, right? But when men's testosterone levels go down, their estrogen levels go down much quicker because they don't have as much estrogen. We have more estrogen, and when menopause comes around, that's when we really go into decline. So cognitively, we really suffer. Cardiac-wise, we really suffer. Or insulin resistance becomes that much more because estrogen also does kind of keep the weight down together with the testosterone. So now you find that your blood pressure is increasing, your lipids are out of control, and now you have more heart attack risk and stroke risk, approximating that of men at that age, right? So what happens if you deal with things in perimenopause? It makes menopause much gentler because testosterone, as I just said, is metabolized into estrogen. So when you lose your estrogen in menopause, what happens is you still have a little that's there from the testosterone administration. If you go that route, you still have some estrogen that's there. So the hot flashes aren't as bad, the mood changes aren't as bad, the joint aches and pains aren't that bad. Menopause is defined as a cessation of your period for a year. So nobody's going to give you estrogen until a year passes from your last period. So testosterone in that time before you get estrogen replacement is very beneficial. And I said it's very beneficial to your breasts, it's very beneficial to you cognitively. Testosterone is really important to women, and that's one of the things that I really wanted to kind of highlight, right? Testosterone or vitamin D or vitamin B, really all of our vitamins, right? And staying away from preservative foods is really important because they're laden with things that are endocrine disruptors that are disrupting our endocrine system in women and men, right? It should also be noted that what I am actually seeing as a physician is very concerning because I'm seeing younger and younger people with testosterone levels that are lower than mine. What was when I tested mine, which means we have 20-year-olds who haven't yet had any families, who are not interested in sex, who are exhausted, and we think that they're lazy, who are having more joint aches and pains than normal. It's not because they're overweight. All of this is because of the level of stress in our society, the kinds of foods that we're eating, the not getting out in nature, which is another thing that helps our adrenaline levels and our cortisol levels to go down. So this modern society that we have is not civilized. It's not civilized at all. It's not a civil society anymore. We become very uncivilized. and it's showing in our blood work, and it's showing in the crises that we're having in general, in families, you know, in just the out of orderness that's happening all around us. Next slide. Great. So yes, so I think I've said a mouthful, and I'm not sure how the question thing is going to work, but I want to thank you guys for listening. I want to thank you guys for being here as a part of this, you know, Zoom call, this Zoom meeting. And I want to thank Stacey so much for reaching out to me and asking me. We've actually been trying to do this for a while, actually. And I don't think she thought I was going to give you guys this much information. I didn't give her any hints on what I was going to talk about and how I was going to portray all of this. But I figured the best thing to do was to give it to you like this, so it really is impactful. So you really know how this thing can affect women by using myself. Thank you, guys. I can't hear you, Stacey. Stacey, you're muted.
Stacey, you can go ahead and unmute yourself.
Thank you so much. And I was just gonna say that Miss Helene, who is actually a nurse as well, like myself, over Health Ministries, I was gonna hand it back over to her, but I simply had to thank Dr. Van-Horne. I've got to tell you, the conversation that we had when I was in the hospital bed and you were helping me out, I just knew there was a wealth of information behind that. And this is fantastic. And, you know, your transparency around what happened with you and your child, you know, in the car, I know how much you love, you know, your boys, and I just can't even imagine. And so it's just been wonderful information to tie everything together. So Helene, I'm going to hand back over to you. I don't know if you want there to be a Q&A in the chat, or if you want people to come off mute and ask questions. I'm going to leave that in your hands. Thank you. Thanks.
Okay. Thanks, Stacey. I'd like to thank you also, Dr. Van-Horne. I started this journey myself probably more than 15 years ago, and I'm still on this journey. And what's upsetting to me as I listen to you is the fact that I have been to multiple doctors, and nobody has ever said to me what you have said. They always want to just put pills on top of pills on top of more pills. They don't draw the labs. They're not looking at the right things. And initially I thought it was because they were primarily male doctors, but then I started to see female doctors, and it didn't improve the situation for me. So I hope you're taking on new patients, because I need a new doctor, clearly. And I thank you so much for presenting this information to us. And so now we are going to start the Q&A. Nicole is going to be in control of that. And what we want to try out is just having everybody come on live and ask the question. That might be quicker than them trying to put it in the chat and we trying to read the questions from the chat. So let's try that, Nicole.
All right, it sounds good. We have the first question by June James. June, if you want to unmute yourself.
Thank you for acknowledging my hand. Good afternoon. Thank you, Dr. Van-Horne, for such a succinct and excellent presentation. You mentioned the dysregulation that occurs with these disruptors. I mean, I'm grateful and I'm thankful that I've not had the issues that you've mentioned. I think it's part of my genes, because my sisters before me did not have those issues. So I thank God for that. But I'm also wondering, I am a plant-based eater, and I'm wondering if there's any studies that you've come across that may animal products might impact what effect it might have in all that we're dealing with as it relates to hormonal balance with the steroids and hormones and all of that that's been injected into the animals nowadays.
Well, I don't know any studies like offhand. I'm sure I could do some research and like find them. But what we are finding is that, well, what we know is that the quality of our fruit and our vegetables is not the same as it was even 50 years ago, right? And the pesticides, all the different things that are being used, in addition to the fact that we now have GMO fruits, right? They're genetically modified. So here in the States, if you buy a watermelon, for example, very few of them have seeds. You know, most of the bananas don't have seeds, right? So even we're eating a plant-based diet, and I'll find that most people, if they are not taking vitamins, they have to take B12 and folate and you know, other things. When I was in medical school and you know, people ate like a normal diet, we used to say you don't have to take vitamins because you're eating like everything, right? But no, if you have to take vitamins because the quality of the food all around is just not good, right? But the preservatives with the hormones that we're using, what happens is that the hormones that are given to the animals and all these things that we have in our plastics, the polyvinyl chloride stuff, when they get leached into water or leached into the food that that it's containing, they act at the level of our receptors and try to behave like a hormone, and they don't allow the hormone to get into the receptor. So even if you have quote unquote normal hormones, they're not allowing the hormones to engage with the receptor the way they should be, right? I think a lot of what we're seeing is affecting us with certainly with the kids having less hormones. I mean, I'm seeing that last week I saw a kid that is 20 years old that has a testosterone of 400. It's a boy. At 20 years old, you're supposed to have the most hormones ever in your life. You're supposed to be like trying not to think about sex, trying not to have an erection. And these are not a problem for him. He's at 400. I have 70-year-olds who have more testosterone than that, right? So there's something really seriously wrong, right? And I mean, often when I look at it from a biblical perspective, you know, in Daniel, it says that there's going to come an antichrist, but really, I don't think it's just an antichrist. I think it's a system that would wear out the saints. And I think this is what we're living. We're living a system that's literally wearing us out, and it's wearing out the kids as well. And so if we don't really pay attention to what's going on, we're going to have kids who are like stir crazy by the time they're like 35, right? Because it's already happening at 20 years old.
We have a question by Angelique. Angelique, I also see you put one in the chat. Do you want to say it or do you want me to read it?
You can read it.
Oh, okay. So Angelique has a question on why is hormone therapy bad? Why did they say hormone therapy is bad? Well,
I grew up in that era, and I think that's why doctors are not doing the tests, and why even me myself as a doctor would have gone for such a long time, not even relating what was happening to me to my hormones. In the 1970s, there's a study called the Women's Health Initiative Study, and it looked at hormonal therapy, women who were on hormone therapy. Quote unquote hormonal therapy, because those were not bioidentical hormones, which is what I'm really talking to you guys about today, whether you do creams or whether you do pellets. these were pharmaceutically derived hormones. And these pharmaceutically derived hormones come from either animals, and in most instances, they come from the urine from animals, right? And they don't engage with our receptor without a lot of serious side effects, right? So when that study came out, women who were on estrogen pills and progesterone, synthetic progesterone pills, Premarin, it might strike, you know, that's some of the things that women were taking. They had to redo a recall and take all of them back. So women remember that, who grew up in that time, and they call those hormones, but they're not hormones. They're not like or biological hormones, right? They're kind of lumped in together when they should not be lumped in together. An athlete taking testosterone that comes from an oil-based lab, you know, somewhere, is not the same as a bioidentical hormone that comes from soy and yam. And naturally, the molecule from that soy and yam are identical to ours. So it's not the same thing. So that's really where a lot of it began. And even though the people who wrote the study back then have tried to, like, you know, do recalls on the studies, and it's even been on the news. But like most things, once you know, everybody is terrified or made terrified about a medical situation, it's very hard to get them to redirect even after studies change, right? So what's happening with a lot of physicians is they, especially since the liability is what it is in the United States, they just would rather not deal with like hormones any at all, and not administer it as far as possible. So they'd never ever have to hear that, you know, something that they did cause a problem. But the studies are there, and they're very clear that if the hormones don't go to the liver and get transformed into bad metabolites, and if they don't come from a synthetic source, from like a pharmaceutical company, and they're natural, that they don't cause those problems.
Thank you so much.
You're welcome.
Okay, the next question, I see a couple of hands raised, so bear with me, but I'm gonna pull one out of the chat. It says, pretty much, when do you need to see an endocrinologist to begin hormone therapy for perimenopause? And are there more natural ways to increase these hormones? And I think you kind of alluded a little bit on that, but that's from Viola Davis. Mm-hmm.
Well, you can see an endocrinologist, but really, you can see an endocrinologist. Your gynecologist may know. I mean, you really want to see somebody who does hormone replacement therapy, period. Like they know about it, and they know about the studies that are current. The issue that we're having right now in medicine is that the medicine is changing. And so there's some people who are going to hold on to the old way of doing medicine. And then there's some of us who are demanding a new way to approach medicine and approach women and men who are going through the slowing of hormones in their lives. Because what's happening with us as women is also happening to men. It's just that men are way more covert about it. So you know, the second slide, I think, had a list of the different symptoms. As if you're having severe symptoms, moderate to very severe symptoms in more than 8 of those areas, then you should just get blood work done, right? And if you ask for blood work done to check your hormones to see what's going on in perimenopause, and your gynecologist or your primary care doctor or your endocrinologist says you don't need to do that, then you need to find somebody who does know what they're doing with that information, because that's what's happening. A lot of doctors, we really straight up don't have time, really, unless the system, unfortunately, it's a system-wide thing where they say, okay, this is how we're going to approach medicine now. That's what's happening. The system kind of is determining how people practice medicine, as opposed to people just going and reading and going, okay, I'm going to change how I practice based on this data and these studies that are coming out. If the system does not say that, like, everybody, all doctors have to do this, then everybody gets treated as if they're the same. When you do hormonal therapy with a doctor who understands what the hormone levels mean, they're going to tailor a treatment for you, the individual. So your treatment's not going to be the same as my treatment. It's going to be the same as anybody else's treatment, right? So you have to find a doctor who understands that things have changed and who knows the current data that's on it. And that's not all doctors. And to be honest, I wasn't that doctor like 10 years ago, right? I missed it myself. I missed it in myself. So I guess that answers the question. You just have to test your doctor and see if they know. They don't all know, and it's not their fault, because we straight up are not taught this in residency. And we're not really, it's not really shone, no light is shot on this when we're in medical school, as it being the huge problem that it is. And I think the fact that now we're in a generation where there are way more women, there are probably way more women in medicine now than men, maybe, but maybe as much women in medicine as there are in men. I think that for those of us who are in it, we're kind of like, okay, no, this is ridiculous. Like, we want to be treated like differently, right? So I'm not sure. What I do know is that there is a wave of people, physicians who are saying, okay, we have seen enough. And for me, I've dealt with enough in terms of the brain fog and all of that, where I wanted differently for myself. And so I want differently for my patients. And you're just going to have to test your doctor with that and see what that relationship is.
Okay, thank you so much, doctor. This is great. We got some more questions. I'm kind of bouncing between the chat and the raised hands. So the next one I'm going to go to is Rosalind. If you want to mute yourself and ask your question.
Hello.
Hi.
Hi. I'm writing with Sister Rosalind. My name is Sister Taimiko, and I definitely had a question about natural remedies for the thyroid.
Natural remedies for the thyroid. Well, you have, ashwagandha is going to help to decrease the adrenaline and cortisol and its suppressive effects on all of that. Yes. If your thyroid is not producing, though, there's not much really to do except to replace the thyroid hormone, right? And I mean, one of those ways, I know that it would not be, the Seventh-day Adventist community wouldn't be interested in that. One of those come from pork, right? It's called Armour thyroid, and it gives both the T3 and the T4. And then you have compounding pharmacies that will compound your T3 and T4, again, bioidentically, and prepare that for you. So these are things that are not available, like in, it's more tailor-made, right? If they compound, it is more tailor-made, and they can't brand something that is natural, right? And that's the struggle that we're in, is a struggle between the pharmaceutical companies and compounding pharmacies that are kind of making it for you, right? That's where the struggle is lying. There are other things that are there, like to help your thyroid, like theanine, and there are other vitamins that are there that will help with the thyroid. But if your thyroid is not functioning, then, and it's not making enough hormone, the only thing to do is to give it back a little hormone, to my knowledge.
Okay. Thank you so much. I appreciate that.
You're welcome.
Thank you.
Okay, we're going to go to Zoom user. I don't know if you can unmute yourself. Zoom user, you have your hand raised.
I think that might be me. This is Kaysan.
Hey.
Hi. So I've actually been in menopause now for 6 years. I haven't had a period in 6 years. And I've seen I've noticed what I eat really affecting how severely I experience certain symptoms. So for example, if I drink alcohol, my hot flashes come back. So I don't have hot flashes very regularly now, but if I have alcohol, then it's severe.
Right.
You were talking earlier about some of the processed foods. So if I have snacks like Cheetos and Doritos and those types of things, I see the joint pain, very pronounced. So my question is, if I've already passed the perimenopause stage and I'm in menopause for quite some time now, would you still recommend HRT, or just kind of continue to manage it as I've been doing?
I think, thank you for coming, Kaysan, because I know you missed the one I had in Trinidad, but this was the
Yeah.
same thing basically the same thing that I did. So, everybody's on their journey, right? And you have to just kind of decide how disruptive are these symptoms to your life. If they're not very disruptive, then fine. I think what women should do though is they should know where their numbers are, like to see that live and direct where the numbers are, because there is scientific data to say that if your estrogen levels are below 30, that your cardiac risk is more, right? Because estrogen is protective of us from a heart attack and stroke perspective. So knowing where your estrogen levels are, I think will help you to gauge that. Doing bone density scans and looking at where your testosterone and your estrogen is, it's more than like hot flashes and mood changes at this point. When you lose your testosterone and your estrogen, you are becoming more osteoporotic day by day, right? The testosterone and the estrogen helps your osteoclast and your osteoblast to form. And yes, they do have pharmaceutical drugs that will help you to so-called like build denser bone. But the fact of the matter is there's no denser bone, and as good bone as the one that your own body makes in terms of osteoclast and osteoblast laying down the bone and having that good framework. So people who do take the yearly infusions or the once a week tablets, they still get fractures when they fall, because the quality of the bone is still not as good, right? So there are cardiac reasons for doing what we're doing. There's osteoporosis reasons for doing what we're doing. And then the cognitive, is also really important, because estrogen, there's a protein that gets laid down in plaques in people who have Alzheimer's or a family history of Alzheimer's. And the one thing that actually prevents that plaque that we now know from forming is estrogen. So if you have Alzheimer's, you have a strong history of dementia in the family, knowing where your levels are is good, because if your levels are low, then you want to optimize that, right? In a woman. And in a man, if your testosterone levels are low and your father has dementia and your testosterone levels are low, you're putting yourself at risk of having dementia earlier, because testosterone gets metabolized into estrogen. So often when I take men's testosterone levels, what they'll see is that their estrogen is also undetectable. That's a red flag for a man. And women don't realize they need testosterone, and men don't realize they need some estrogen, right? So we just have different amounts, right? Women, biblically speaking, came out of a rib of man. And I think there's a friend of mine, I think, who's on, who discerned and taught me that really that rib was likely a rib that came out of the chromosome, right? Maybe we think of the rib just as like, in the side, but if we think of it like chromosomally, if a woman came out of a man, then everything that a man needs, a woman needs, right? It's just less, right? And that's certainly the case when it comes to hormones, right? So what I would suggest is that you find out where your numbers are, because there are things that are going on underneath the surface that you're not really aware of. Kazan,
Thank
are you
you.
there?
Yep, yep.
Okay. All right.
Thank you. So in the chat, when you mentioned vitamins in your slide, there's a question about what brand of vitamin would you recommend?
Well, I don't know all of the brands. I don't know all the brands. You know, a vitamin B injection, the methylcobalamin for your B12, as long as that's there, I give my patients that in the office for those who don't like to take pills. The pellets that I use for biological hormonal therapy is BioT, and I just use that as a brand because I know that the quality of their product is good. I don't know all the brands though. You know, I guess you just kind of have to go on Amazon and look at like what people say about it. Vitamin D, I know for sure all of that is not created equally because a lot of my patients, they're very proud that they're on vitamin D, and then when I take their blood work, they're surprised to see that like their vitamin D is like inadequate, right? So I would say when it comes to vitamin D, just to make sure you're taking a very good vitamin D and something that has vitamin A, D, and K in it, because the ADK is what keeps your arteries, your and the vessels in your brain and your heart, etc., clean. That combination of a vitamin D tablet is the best, right? And unfortunately, our insurance companies don't cover the ADK version, right, of the vitamins. And in fact, the insurance companies don't cover anything that is really good for us, right, which is problematic, right? But we're so distracted by so many things going on in the world. But, you know, they charge more money for just to check your vitamin D levels, right? There's some patients who come to me and say specifically, please don't check my vitamin D levels because the insurance company is going to charge me just to do that. There's something wrong when your insurance company doesn't want to do preventative healthcare, right? If we could just come together and like figure out that like these people are messing around with our health, you know, and putting money first in every single way. But that's another discussion. But in terms of brands, I don't know all of them, but I do know my BioT is the brand that I use in my practice.
Okay, we have a question from Dr. Juliet Tracy. She asks, first of all, she wants to say thank you for sharing your wealth of knowledge, but have studies shown variances in perimenopause symptoms based on race?
I don't think that I know of any study of perimenopause varying based on race. I don't know of any. I would be straight making it up. I can say that what I've seen in my practice is when I look at whether somebody complains of the effect of the hormones has to do with the level of stress that they're under. But there is definitely a mind over matter component where I'm looking at people who are undetectable and they're not as bad as I think that they should be, right? And they're powering through despite being undetectable. And they don't realize like that they really were in a bad place until I replaced the hormones, right? So there may be some, I wouldn't say necessarily a racial, but maybe a cultural aspect to that. You just kind of suck things up. And I think that's what I was kind of getting at when I put the health assessment questionnaire and I was saying that women, and there are some men who just put none, they have no symptoms. They have no back pain, they have no joint pain, they have no physical exhaustion. They don't have anything because they're just like, well, that's life. You just have to deal with it. And so what are you going to do? You're going to help me? Nobody can help me, right? So I haven't seen a racial difference. Of course, I do know that men of African origin tend to have a little bit more testosterone in a lot of instances, and so they may fall off at a later period of time. But I think that the endocrine disruptors in our food and the environment that we're living in right now and the stress that we're living in is equalizing everybody. Like everybody's low or falling at a more exponential rate.
Thank you for that.
I'm going to just add on to that too. When it comes to research and studies, unfortunately, it's hard to make a comparison with race, especially African Americans and other races, because we do not get African Americans. When I say we, African Americans do not get involved with research, and for good reason. And Tuskegee Institute research study is one of the many reasons why we don't. So it's so hard when you try and read on research studies. It's not a whole lot of, the comparison is so much different because there's more of other races than it is for African American that's involved in those studies.
True, that's a good point, yes.
I'm unmuted. Elizabeth Cook and myself would like to know, how can we make an appointment with your office?
Well, I do telehealth, right? For people, because I know you guys, most of you are far away, like in Orlando. And I have a website, VIPobservation.com. That was on the thank you slide. And my phone number is 954-470-2851. If you WhatsApp that and send your full name, your date of birth, your mailing address, and your email address, we will get back to you like within 24 hours. A member of staff will get back in contact with you, and we'll send out paperwork for you, and you can send back your insurance information, etc. And I have been going to Jamaica like once a month. I am trying my best to go to Trinidad at least every 6 weeks or every other month or so. I'm working on that. So I'd like for more women and men to know their status. That's kind of like the aim that I kind of like a mission I'm on right now in this phase of my life.
Thank you. All right, we have another question. Can constant tingling in your arms and legs be a part of perimenopause?
Big time. There's a patient who, I hope she's on right now. She came to me and that was her only symptom. And she had done MRIs, she had done a whole bunch of stuff. And I said to her, I think this is just menopause. I think this is because your numbers are low. And she was like, please, She did it because her numbers were so low. And she wrote me back like about 2 weeks later. And she's like, you think it's mind over matter, but the tingling is gone. And I was like, no, I told you. I told you. But those are one of the symptoms of menopause that a lot of women don't realize, that there is this tingling and it's estrogen dependent. And actually women who are have been in menopause for a while will start to get the tingling as the estrogen levels like tank up, and then it goes away again. And then really weird things like burning of the tongue and burning of the inside of the mouth, ringing of the ears. A lot of women say like, oh, I didn't have any menopause symptoms, but they have all of those other like little weird things, right? Just joint aches and pains, weird bursitis in weird places, like you never played tennis your whole life and you never had a job where you had to put things up above you, but then your shoulder, your shoulder keeps getting sore in the joints. Like those are not normal things. Those are hormonal pains. So yes, that can definitely happen.
Okay, and we have another question from June who asks, what is the source product of Bioti? Is it wild yam, soy, animal, etc.?
Yam and soy. Yes, it's yam and soy. I had mentioned that earlier. Anything that says bioidentical, that's where it's coming from, right? And they use yam and soy because they have the exact molecular structure as ours, and so it fits into the receptor like a lock and key, right? And the pharmaceutically derived products that are out there that unfortunately the insurance companies force us to prescribe for patients, which is why a lot of doctors just avoid the conversation because they don't want to prescribe those things because they know in 3, 4, 5 years bad things are going to happen. Like if you're on it for too long. If there are any women in the audience who are already on it, it's okay to take it for a short period of time. The studies have shown that it's okay to take it for a very short period of time, but it's not okay to be on those medicines for like 5, 6, 7, 8, 9, 10 years, right? So that's why a lot of doctors try to avoid that conversation.
Okay. And there's a question kind of piggyback on how to get in touch with you and how to get in to see you. But if it's not covered, it says if HRT, I take that with you, it's not covered by your insurance, how feasible is it to pay for out of pocket?
Well, some people have HSAs and the HSAs will cover it, right? That's the money that you put, there's some insurance plans that have a thing where you can put money away and then use that for any healthcare thing that you desire. So a lot of patients who recognize that they need it, they'll choose that as their health plan. In my office, what I've done is I have a membership, and in the membership, if you have the membership, then you can get the pellets like at half the price. So the pellets are going to in the United States anyway, it's going to be about $500 wherever you go. But if you have the membership, then I decrease it to $300, but the membership does cost $100 a month. So that works for my patients who don't have any insurance, that if, when they do need their pellets, they can get it for cheaper. And then if they pay the $100 a month membership, they can call me whenever they need. They can get a telehealth appointment. They can come in like whenever they need. We give them vitamin B tablets or whatever other vitamins they need at a very discounted rate. So that's how, it's dealt with in my office. I'm not sure what, there are other things too, like, there's a buy now, pay later in a lot of offices. Like in my office, there's a firm, like you can get it through a firm and a firm will basically pay me, and then you can pay a firm $47 or $50 a month, or pay as you can, kind of like a credit card. In other practices, I've seen that they've used what's that? They have other ways of all buy now, pay later scenarios, right? Where you apply for the credit and the company gives you the credit and then you pay for it over time. The thing that women are really faced with this is, do the insurance companies determine everything about your health, or are you going to have to take take control over it? Really, what should really be happening at this point, which is beginning to happen, and which is one of the reasons why I'm with this company, is that they're lobbying. I don't know why we have to lobby people who work for us, but they're lobbying the Congress to change this, right? Because we are recognizing like how devastating this is to women and men. But that's going to take some time, right? And we're also in this company going into the universities to try to change how this is taught to medical students, right? To let them know like how important this is to every single system, and in residency programs, how important and devastating this is to every single system, and for this to be on our radar a lot more than it is right now.
Just to kind of go back with the pellets, are all the pellets kind of made equal in essence, or is there more of a natural one?
It's a good question. All the pellets are not made equally. They may all come from soy and yam, but some of them have other components to it, or some of them may not be as concentrated as others, right? So some people do get pellets from other brands or just other pharmacies, and they said they didn't feel anything, and that's probably because the concentration is varying from pellet to pellet. Other ones will also have addition of steroids in it, which they've added because they want to decrease the amount of scarring that may happen at the entry point, or to decrease the pain. Not that it's very painful or that it causes very much scarring, but if it has steroid in it, then it also is being shown to decrease the effect of the hormone as well at the site. So there are a lot of different nuances, and that's why it's good to choose a doctor who really knows those things as opposed to somebody who doesn't, right? You want a doctor who actively is engaged in doing it, whether be creams or be pellet therapy.
Well, I think that pretty much wraps up the questions. I don't really see anything else. If anyone else have a question, you can unmute yourself and ask if you would like at this time. Otherwise, we're going to close out. Okay.
Okay, I think that's it for the questions. So we're going to close it out. Again, I want to thank everybody who tuned in. We appreciate your participation, your engagement, your questions, and I hope we were able to cover all your questions. If not, the information for Dr. Van-Horne was on her last slide. We also recorded, and so it will be in the hands of Patmos Church, and we will try and get them to put it on some of their social media sites. And also Elder Stacy Berry will have a copy, and so some of you can speak to her about it, about obtaining a copy. So at that, we are going to close out, and if Elder Berry could give us a closing prayer.
Thank you so much, Helene. And we just want to thank, let me start by saying our health ministries leader, Helene, and her team. We want to thank you that you allowed us, ladies, to come together on a safe, confidential platform and have this fantastic presentation, to be brave and talk about the reality of what we're dealing with as we age. And we're thankful for life. And then again, just to repeat, Simone, you've outdone yourself. And certainly when we spoke, I could not imagine or fathom that you had this wealth of knowledge that really edified us. So from the bottom of my heart, friend, I want to say thank you. And I wouldn't be surprised if I get questions about how to have you back, but thank you very, very much. We know there are folks that are on the call that are not necessarily members of Patmos Chapel or any church. You just heard about this great presentation and you're going through symptoms yourself and you joined. So we want to make sure that you're feeling welcomed as well in this sisterhood. My husband actually just told me as he was heading out that he was eavesdropping and this was great information as well. My mom is here visiting. Everybody is thoroughly enjoying this information. So let's go ahead and pause for a word of prayer. Heavenly Father, we want to thank you for allowing us to hear this sound, evidence-based information. Lord, I thank you because Simone was not really on to sell her product or to get appointments. She's really just sharing with the sisterhood based on her experience. And I thank you for her big and kind heart, willing to travel, willing to get on Zoom, willing to give up her afternoon. She was willing to come to town if necessary to do this presentation. So bless her and her family. Lord, it still tickles me that she read The Great Controversy, that outstanding book, that she took her boys over to the River Jordan to be baptized. And so she's having her own spiritual journey. And so we just pray for each lady, each family represented here. But I really want to pause and pray for each lady represented here. Sometimes we're so busy thinking and praying for others, maybe it's the estrogen, that we sometimes forget to focus on ourselves. So I truly am praying for each lady on here, that we will now begin to look at making necessary changes to help our bodies as we go through the next phases of life. And whatever that looks like, I pray that you would help us to really help this temple of ours to make it through these very stressful times. So bless and keep each sister on the sisterhood and just be with us, Lord, as we learn and we apply what we've learned. In Jesus' name, amen.
Thank you for having me, guys. It's my pleasure.